Greetings, Zimbabwe, Africa, and the world. Welcome to In Conversation with Trevor, brought to you by Titan Law. I go beyond the headlines and beyond the sensational. Today, I'm in conversation with Ngobile Muzara, Dr. Lance Mambondiani, Dr. Sacrifice Chirisa, who are representatives of Business Fighting COVID-19 Trust. Enjoy this instructive conversation. Dr. Lance Mambondiani, Ngobile Munzara, and Dr. Chirisa, welcome to In Conversation with Trevor. We are talking about business fighting COVID-19. Welcome. I'm delighted to have the three of you onto our show today.
Thank you, Trevor.
Thank you. Thank you so much, Trevor.
Lance, let me start with you. Explain to us what the thinking is behind the formation of this organization, Business Fighting COVID-19.
Thank you, Trevor. And firstly, just to say thank you for giving us this platform, just to share our views on what we're doing as business in as far as this is concerned. Of course, to extend a special thanks to all your listeners and viewers and all the work that you're doing. Really, really appreciate it in the community. So business fighting COVID. See, our position on this, Trevor, has been that there comes a time in the history of humanity where we believe that we are faced with a challenge that is bigger than our individualism, than our stations and our callings. And there's a time really in our existence in which our business is what we represent, and some of the things that we do as companies is actually threatened collectively. And it doesn't matter what station you are or what the code, whether you're the CEO of Bank ABC, or you're the founder of the Alpha Media Group, or you are the CEO of Lafarge or United Refineries. All of us and the way that we do business has been impacted exactly the same. Whether it's in Zimbabwe, it's in the UK, it's in the USA, you can see that we have been unified by one common threat, something that is fighting. To really, really threaten our very existence and our going concern as businesses. Mm-hmm. So our belief, and one of the things that we wanted to do was to come together as the business community in Zimbabwe and then establish what you rightly said, what we call the Business Fighting COVID Trust, which is really to complement some of the efforts that we've seen from the government in mobilizing and channeling resources where we believe that they are needed the most. We know that a crisis such as this is not something that can be done by one entity, by one government, or by one organization. We can only achieve and win against this pandemic if we are collectively marshalling all our skills, all our capabilities, and all our resources. All of us have various skills, whether it's in media, it's in banking, in resource mobilization, whether it's just in putting together and marshalling resources together within the donor community. Imagine what we could do collectively, was to bring all those skills and all that knowledge, all that information, and just all that passion together, just so that we are fighting this pandemic. And that is the essence of business fighting COVID, which is really putting together our best foot forward as a business community in assisting government in addressing some of the challenges that is affecting each and every Zimbabwean as far as this pandemic.
Interesting. Dr. Chirisa, let me come to you now. As a medical doctor, you are at the coalface of the pandemic. Speak to us, Dr. Chirisa, about the challenges that you are encountering as an organization when it comes to fighting COVID-19 right now.
Thank you, Trevor. I think it is important to look at the whole picture, looking at the health facilities that we have in country, the facilities that we have in country, both in private and government, they are below the expected standard, especially if we are to deal with COVID and its complications. So that really was a big threat. And also the other thing that ended up happening was that every country had a similar threat worldwide, and people were now protecting what they have. There is no opportunity for anybody to fly out or to go out. If something happens to you, no matter who you are, no matter your status, you have to be treated in country. So it really gave us a call and said, we might have neglected our health facilities for too long, or the medical sector as a whole for a very long time. And now it has come to bite us. And the whole thing of business fighting COVID is really to put our hands together and say, yes, we have these deficiencies. Yes, we have these problems, teething problems. But what can we do? This is not time to point fingers and say this one is wrong or this one didn't do that. But this is time to put our heads together and say, what can we do to help and to move the situation forward, to improve and to make sure that as a population, as a nation, as a people, we survive and we do the right thing. And so that's really the essence of our thinking. And as part of the medical fraternity and the medical doctor, and being part and robbed as a trustee within the business fighting COVID, that's really our aim. And that's what we are pushing for.
Fantastic. Mobile, if I could move over to you, tell us about your involvement and the role that you're playing in this, in the trust, and what got you, to jump onto this noble initiative.
Thank you, Trevor, and thank you for having us on the platform. So essentially, I support the trust as the secretary, just to make sure from an admin point of view, all the work that needs to be done administratively is put in place. We have regular meetings, and there are some updates that, the trustees share. So my role is just essentially to make sure all that admin happens smoothly, and from a, a constitution perspective, that the trust is going well. But how I got involved was essentially Lance, reached out to me and said, Mobile, we've got this trust that we've set up. And this was just after the lockdown. And he asked if I could assist with some of the running around in terms of us, distributing some donations. So one of the biggest impacts that happened soon after the lockdown was that people who rely on day-to-day either vending or day-to-day selling or day-to-day income generation activities were no longer able to generate that income. And so the number of vulnerable people in our country sort of increased. And first, call that the trust did was a call for donations in terms of food. And we had great response from SICO, where there was quite a lot of bags of mealie meal that were donated. So I came on the trust and essentially assisted in the distribution of that mealie meal to a lot of vulnerable people under the Department of Social Welfare, under various groups. There were also old people's homes that we donated to. And, Musasa Project was also one of the recipients, where they look after victims of domestic violence. So that's how I got involved. And, it's just continuing creating awareness from a social impact, and also from an economic impact on the business side, just to bring that awareness and help business persons to come together and come up with solutions.
Lance, what's been the response like from business? Are you happy with the response that you're getting from business, first of all? And secondly, what would you want to see more coming from the business community to support this noble initiative?
Well, Trevor, there is always a greater need than we can satisfy, as you know, and I always want to give something relevant. As we speak to you right now, you are aware that there are nurses outside in Paringa who are demanding more services or more assistance in as far as the remuneration is concerned. But that just gives you an idea. And when we were having our meeting yesterday, we did notice that there is a common trend that the people who are on the front line are looking for some of the basic things that you and I take for granted. For example, want paper to print the results that are actually being distributed to people, just food to get by on a day-to-day basis. And yes, we know the common things that is always required, which is the protective clothing and stuff. Some of the things that are key. But in short, the response of the business community has been encouraging. We would like the business community, and actually my call to the business community is that we can all do more collectively. There's more that we can do to reduce the plight of nurses and doctors who are in frontline at Parrenyatwa. There's more that we can do to decentralize our efforts to other areas which are probably neglected, not receiving a lot of assistance or donations. Masvingo, Mutare, Gweru. We tend to focus and concentrate some of our activities around the major cities, which is Bulawayo, Harare, and that is kind of normal. But if you look at the impact of this crisis, we have a serious problem, as you know, in Vic Falls, in Beitbridge, where they are retaining. So we would like really just to call on the business community to assist whichever way they can and wherever they can, to provide donations, both in cash, in kind, or just in going to some of our needs list and providing that assistance where it's required, whether it's PPE or it's cash donations that is required. I know we're going to talk briefly now on what has happened in the past, but I'll give you an example of some of the partnerships that entered into with CIDCO as one of our early partners, where they provided us with quite a number of bags of maize that we distributed, like Mobile was saying, to those vulnerable members of the community that had been rounded up and put in protective areas. We managed to give them a couple of bags of millet meal just so that they can have a little bit of sustenance. We donated again those bags to nurses and doctors in the front line at Parrenyatwa, at Harare Hospital, and Shungiza Hospital. Those are some of the things that we are doing practically on the ground to assist those who are vulnerable and those who have been impacted most by this. I can never say our call is enough or is limited. We would like the business community to come in and assist us in joining hands with us in going as far as we can to assist those who are vulnerable.
Lance, I'm going to push you there. As a businessman sitting at home and listening to you right now, I'd be asking, what is it that business fighting COVID would want from me? Can you be specific, Lance, in terms of your call to action, what it is that you'd want to see business jump in and help with?
We have a greater need, Trevor, in as far as PPE equipment is concerned, that is gloves, testing kits. We have greater need that we require. Right now, we are joining hands with a hospital. I can't make it public yet because negotiations are still underway, but we are in immediate requirements of about 10 beds. We're setting up an entire wing, again, to assist members of the public that might be affected or infected by the virus, so that we are giving a public response in a public institution. So we adopted a wing at one of the public hospitals that we are currently in the process of refurbishing. We're in immediate requirement of beds, we're in immediate requirement of ventilators, we're also in immediate requirement of the protective clothing requirements, test kits, again something that we immediately require. We also require foodstuffs. We require further donations in milling meal, in just the basic nutritional goods that we are offering to nurses in the front line. Of course, where possible, we also require cash donations to assist where required, just so that we are mobilizing the resources as effectively as we can. So if people are looking to donate, they can donate in cash or they can donate directly into the area that they believe that is most required. Some institutions choose to procure the material themselves and then donate them as material. We are also welcome to partner with you in as far as this is concerned. I just wanted to add and say that business fighting COVID is a mobilization tool, and our intention is to make sure that we are mobilizing resources and channeling them wherever we believe that they are needed the most. So we are a conduit, we are pass-through of receiving donations from members of the business community, so that we're not duplicating our efforts and we are not piling all our resources at one hospital, say Wilkins or Parenya or something like that. We have a little bit of an insight into what is going on. We don't claim to have a monopoly on knowledge, but we believe that once we centralize our efforts, our capabilities of channeling those resources to where they are needed the most is probably a lot more better and a lot more heightened.
Maverick, if I could turn to you now, do you have people coming to the organization saying, could we have PPEs, could we have test kits, or it's a question of you and the members of the trust going out and finding out what it is that is required?
Thank you, Trevor. At the beginning, soon after the lockdown, we had both happening. So there were people coming through, and we also went out and tried to identify, especially from the food needs perspective. Then we compiled a list, and then the distributions were done. For now, moving on to assistance on the health side, we also then reached out to a few hospitals around the country and asked them, can they give us the needs that they require in terms of PPE and other equipment. And then that's the list that we're now using to seek out donations from business. So it's both. We're available on social media. We're also available online. There's a website of the trust for anyone to get in touch.
Okay. Dr. Chirisa, I mean, obviously on the medical side, the issues relate to the PPEs that your colleagues have highlighted. There's testing. The country is not testing enough. And I want to get a sense from you in terms of where you sit as a trust, whether there's anything that you're doing in that regard. And is the private sector coming in as far as testing is concerned? That's the first issue. The second issue is contact tracing. Is this an issue that the private sector is involved? Is it an issue that is exercising the minds of the trustees and indeed the trust? And then lastly, the isolation centers. Is there anything that you as a trust are doing when it comes to the isolation centers? So those three issues, Dr. Chirisa.
Thanks so much, Trevor. The questions that you asked are really a mouthful in themselves. Obviously, when it comes to PPE, this is the basis of ensuring that the health providers do not get infected. And what we have seen in other places was that there was a lot of cross-infection from patients to the service providers. And so there's a huge gap in terms of PPE provisions. We were speaking to one of the biggest hospitals in the country, and they were telling us that they've got PPE enough for 2 weeks. And the amount of PPE that is needed is really a lot. So the PPE drive needs to be maintained. The pedal on the PPE needs to be maintained. I know that right now, the country is at large, it seems as if the fear for COVID has gone down, but as we can see, the cases are going up. And if we do not maintain the vigilance, if we do not maintain, the push and to do the things that are necessary, we might find ourselves in a reversal of situations and things really scaling out of hand. So I would really want to urge everybody to maintain a bit of more the same level of vigilance, even though we know that the economy is open. Then it comes to testing. Are we testing enough? Obviously, the answer is no, and the reason is the availability of the testing kits. And the pricing of the testing kits in country, even within the private sector. We were actually, obviously, they are doing what they can in order to test, especially the private labs. But $65 US is quite inhibiting for most people, especially at this level and at this current level. So the testing obviously is behind. But what we have seen is that quite a number of corporates have started to test, and that's why you then see that the testing figures actually went up. This has to do with corporates that are testing. am privy of that because I'm part of a number of corporates that have tested in thousands, and we have had to send people for PCR, as private. So private has contributed in terms of testing, especially of the general public. But obviously,
Dr. Chirisa, so the testing that happens in the private sector, is it included in the cumulative numbers that are shared by the government as testing done for the day or testing done for the month or week?
Yes. Ideally, when you test, even with the rapid ones, you are supposed to be given a certificate by the national labs.
Right.
And when you go and get that certificate, they actually give you access to the database. So when you test every day, you actually feed into the national database. So some of the figures that you are seeing are actually as a result of the testing which is going on in private. But obviously, I cannot speak fully because it's not my domain. But yes, that's what is supposed to happen, and we've got access to feed into that. When it comes to the isolation centers, when they started, there were very few. But in a very short time, there's a massive proliferation of isolation centers into almost every province, every district. So there are so many, and they're widespread. And obviously, we've got some key isolation centers, but there are just so many. And obviously, the people were being housed mainly in, for those who could not afford the hotels or to pay for themselves. They were being housed by the government or in government facilities. And we saw pictures of these facilities needing a lot of attention.
So those problems have been dealt with by your trust, Dr. Chirisa, and do we have enough isolation centers? So, and also demarcating, Dr. Chirisa, my understanding is there are private isolation centers. These are your bed and breakfast kind of facilities, and there are public facilities that are provided by the government. Are we in a happy place as far as those facilities are concerned?
Yeah, obviously the private ones they fare much better in terms of facilities, but the public ones they are not in such good space. But what we have seen is that a lot of work has gone into most of them boreholes being drilled so that there's water, food being donated to those places. So a lot of is being done. But the question is, given the extent and the number of isolation centers, more can still be done and more still needs to be done because people are still returning. People are still coming in country. In the paper today, there were 9,000 people that came in the past 3 weeks from over 48 countries. And at this juncture, to totally leave everything to the government is not practical. We know that it doesn't have the capacity to do everything. If it did, there was no need to set up business fighting for COVID.
And contact tracing, if you could just say something there about the contact tracing, is there anything that the trust, are there pressure points as far as contact tracing is concerned that the trust is dealing with?
I think it's being done. It's being done pretty well. That's why we are seeing a lot of people coming in and a lot of new cases being picked up every day because of the contact tracing. Obviously, that department needs support because some of the people are very widespread in terms of geographically, and there'll be need to support with transport, with fuel, with PPE. And while they are doing that, these people, they also need to be sustained while they are doing that. And so there is a need. Every aspect of COVID response still has got gaps. There is no aspect of the COVID response which we can say that this one is complete, it's dusted, it's done, and we will not focus on it. So every component, the contact tracing, the health facilities, the health provisions, the health providers, every component, there's still a need. There's still a need. And that's why we are coming, even at this time, where it seems as if the COVID issue is losing steam. And we are coming out, and thanks, Trevor, for this opportunity to say, let's not lose steam before we are sure that this thing is really out.
Doctor, let me press you right there. If there was one thing that you would want business leaders watching your show right now in Zimbabwe, on the continent, in the diaspora, if there's one need that you'd want them to jump around and address, Doctor, what would that be, that specific need?
I'll speak with bias, of course. Being a medical practitioner myself, one thing that we have seen and that we are seeing, especially in our nation right now, is the remuneration of the frontliners. That in itself, if it is not corrected, will really put the whole efforts that we are doing into jeopardy. So some form of real substantial, risk allowance, risk factor will be key in order to make sure that all these things that we are doing, because we are going to have well-furnished hospitals without anybody to offer the services.
Thank you for bringing that up. Lance, let me come to you now. I was looking at the lineup of your partnerships, and I was wondering, you've got Nedbank as a partner, you've got VIA, DHL, KEBS, Old Mutual, and Sidco as a partner. I would have thought that there'll be more partners, Lance, coming up to line up. Or do you have people jumping in, coming in? Are you updating that list? Or there are some administrative issues that are limiting more people coming up and being partners?
No, there's absolutely no limitation. What we have listed as partners is people we have actively done some work with. We're updating this list as we go on.
Okay.
VIA, of course, with logistics, which is in moving some of the things that we have mobilized in as far as resources are concerned from one area to the other. They've assisted us in moving the donation we received from Sidco, for example, across the various areas that we've done donations to. Old Mutual, as you know, has come in really with significant donation of PPE. They did a donation of, I think, about 2,000 masks, and again, announced that scheme that they did 400 aprons, 400 overalls, and again donated about 600 of those to Sally Mugabe Hospital. Sidco, as you have said, donated quite a significant portion, 5 tons of maize to Parenya and 3 tons to Sally Mugabe, and again about 2 tons to Chitungwiza Hospital. So these are just partners we are working with right now. There's no limitation on partners that we are bringing in. Whoever really would like to join hands with us, and I'm just mentioning this because these are some of the big entities that have assisted us with the capabilities of really making sure that their donations reach the intended beneficiaries. So like I said before, we are a conduit. We are here really to make sure that we are channeling those resources where we believe that they are needed. But listening to your conversation with Dr. Chirisa, Trevor, there's an element I wanted to bring in as well, which is particularly important to us as business fighting COVID. So whilst we are concentrating quite a lot on donations and making sure that what we are mobilizing gets to the intended beneficiaries, there's one element which we are also concentrating on, which is the impact of businesses, or what businesses are having to go through as a result of the COVID crisis. Which is sharing our information on, for example, testing. What do businesses have to do in as far as testing is concerned? And when they have tested, where do they get the resources, and how do they test? And what are the experiences? How do you feed into a national database? How do you deal with the fact that you have employees who are probably working from home? What are the best practices that businesses are employing in as far as the work from home schedules are concerned? Things like salaries. What are you doing really to address SMEs that cannot pay their employees? How do we take that as a policy intervention so that we are bringing it to the authorities to really provide the relief that is needed by businesses during this very, very difficult crisis, just so that they are sustainable, or that they are a going concern when this crisis is over. So it's not only mobilization that we are focusing on. We are also focusing on sharing information, policy intervention, lobbying the authorities, and just giving some of our ideas and thoughts as businesses on how we've been collectively affected by this crisis and this pandemic, because we have the benefit of sharing that information as a panel. So that is another important element that we've been focusing on, really just to make sure that we are speaking with one voice.
That's an important intervention, Lance. And I want to press you there in terms of what is coming across to you from business as their pain points that require the attention of government as far as fighting COVID-19 is concerned.
I know that Dr. Teresa spoke as a medical doctor. I'll speak as a financier. One of the things that we've really been seeing, which has been critical, is the inability of businesses of meeting their loan repayments, inability really to provide some working capital capabilities for their businesses, to pay salaries, and really just the struggle economically that businesses are going through right now. There are a couple of interventions that we have proposed as part of our policy suggestions, really through CZI and also to the central bank. What do we do to do loan rescheduling? Our proposal regarding tax holidays of sorts, and also some interventions on maybe cutting the best interest rate from 35%, reducing the burden just a little bit during this period. You know that the government has done quite a lot in deferring rentals. But rentals is just one part of the chain. What happens to me as a business if I do not have capacity of employees because I have not been generating income for the past few years? What happens to me as a business if I have a loan from Bank ABC and I can't meet the repayment of that loan because I am a tourist business that is operating in Victoria, where there is 0% tourist arrivals? So there are a number of things that are fundamentally problematic with the lockdown. So whilst the preservation of life is important, there are also some real life issues that we are dealing with in as far as the business community is concerned, which has affected the viability of SMEs, viabilities of mothers and fathers who make their livelihoods by selling tomatoes on the side of the road. So we don't have a bailout package. I know that the government has announced an $18 billion bailout package. We've also given some of our thoughts and suggestions on how we believe that should be structured, the people that should benefit from it, and how they should benefit from it. Because those are some of the things that we really now need to start thinking about. Now that we have done the containment of the disease, how do we move then to support those businesses which are affected by the lockdown, so that we're not having a massive job loss, which we predict might be a reality if there is no policy intervention from the authorities.
So what I'm getting from you, Lance, is something I think which is hugely important. Business has gotten together to fight COVID-19, but business is ailing itself and requires help to be able just to stand on its feet, let alone be expected to fight COVID-19. Are you getting any joy in terms of the policy inputs that you put across to the national government?
Well, Trevor, this is a continuously, a continuous process of negotiation. I can say that some of the interventions that we have pushed through have come through. You do know that the issue of the bailout package started in South Africa when the South African government announced the same. We thought that was a critical process that we needed to implement ourselves. As CZI, as business and everybody, we kind of put through our own suggestions on a bailout package and how we thought that we could do it. Now, we come abreast to the fact that we have serious economic challenges as a country. But we wanted to have something that we believe that was tailor-made to us and also with challenges that we have. So our suggestion was that if we can raise a substantial bailout package in the type of what South Africa have done, let's look at complementing that with other interventions. And those interventions, I said before, will be cuts on interest rate so that we are reducing the tax burdens for those who are producing PPE, for example, locally, so that we are reducing reliance on importations of some of the PPE, because now we are diverting resources towards the importation of PPE, and we are seeing the resurfacing of EOQs, because now we have a stretching of some of the resources. So those are some of the fundamental challenges that we face because of the disease that we have seen as a result of the challenges of COVID. So yes, business is struggling, but within our struggle, we want to push as much as possible some of our thought process of the interventions that we believe governments need to do, from bailout to tax cuts to tax holidays, and really some of the things that we believe that business have been calling on. I can say it's a process of continuous negotiation. We have seen progress on others. We would like to see a lot more progress on a few others interventions.
Thank you, Lance, for that. And Mobile, would you want to jump in on any of the issues that have been raised?
Thanks, Trevor. So for me as a lawyer, I think one of the issues that we've continued to see affecting business from a legal perspective is the number of statutory instruments that come out every week, from government, requiring updating the legal framework to deal with the COVID response, and also just placing obligations on business to say these are the conditions you must put in place in your offices regarding social distancing, regarding dealing with customers, regarding just how to minimize the spread of COVID in the office. So it does become a bit overwhelming to read through all the statutory instruments and all the amendments that come through and ensure that you're actually complying. And it's not just those, but you also have returns that have to be made every now and again regarding compliance with NASA requirements, compliance with also the health authorities. And as Dr. Chirisa was saying, that if you do any testing, how to then make sure that what you're doing is in line with what the authorities expect of you. So it's quite overwhelming for business to just try and figure out, and digest all of those statutory instruments and make sure that they are complying and, they are not falling short. Then there was an issue I also wanted to comment on, which Dr. Chirisa mentioned, that you asked him about isolation centers. So over the last, few weeks, the trustees of the Business Fighting COVID Trust have been, trying to figure out how to bring awareness, and this is a campaign, that is still ongoing, to say, as a business owner, if one of your staff members tests COVID positive, how do you deal with putting them in an isolation center? How do you deal with the family of the person who's tested COVID positive in terms of, can they go home, can they not go home? And also, how do you then proceed to the next stage of testing, which is the PCR test? And for how long should the person be gone? So the issue of isolation centers for business response is quite critical. And once the person is gone, do you have measures in place for their work to continue to be done by somebody else? So it's an issue that's, that is still quite, the trust is dealing with, and trying to also bring that to the business community to say, maybe there's need to come together to identify specific isolation centers as the ones that are developed by government or available from government are full to capacity. So there's need for that, and also to take care of the basic issues within those isolation centers, as Dr. Chirisa was mentioning, medication, and also, toiletries and that sort of thing. So, and also ensuring that, there's continuity in just the checkups and so on for staff members. So as a business owner, that's something that we're saying you need to be aware of. How do you deal with it? What are your response? There's no uniform response. There's no policy direction from government or from the authorities to say, when a staff member tests positive, these are the steps that you take. So it's something that is quite critical, but it's a lot of statutory instruments, and it's a lot to try and make sure you're complying.
What are you as the business coming together to fight COVID-19? What are you proposing in terms of the multiplicity of the statutory instruments in the first instance, and then secondly, the lack of clarity around what needs to be done regarding the people that do test positive? Have you put together a position paper before the authorities to consider?
Thank you, Trevor. So on the legal framework, I think, what is clear is that because this is a unique situation, we are learning as we go along, you know, and world over, I think everyone's experiences are similar to what we're going through, because it's a difficult environment to try and then contain the cases to ensure that business is responding. We haven't put together any position paper to the government specifically on that legal framework. We're focusing more on the issues to do with, you know, as Lance was saying, that the tax holidays and the economic impact from the business side. Then in terms of business response, you know, so I think from the medical side, there's been a bit of work done. We also got heed of that there are some international organizations that have put together some documents, accounting firms that have gathered information from different jurisdictions and say, these are the practice notes that business can adopt in order to respond to COVID, you know, in order to respond to how to, you know, deal with a staff member who tests positive, COVID positive on the rapid and maybe negative on the PCR, and how to deal with them during that intervening period.
Interesting point. Dr. Chirisa, do you want to jump in there? Because as a company, it would help if a corporate would have a document that says, these are the steps that you take, you know, from the testing, from if they are tested positive, this is what you do, this is the isolation center that you take them to. What's your view on that, Doctor, in terms of how we go forward?
Okay, thank you, Trevor. Maybe just to bring you back a bit on what Nobila was alluding to, you know, with the multiple SIs, and also the lack of SIs. For example, a case in point is with the medical, with people in the medical business. There was an announcement by the president that there'll be a tax break or something like that for the next 6 months, but it cannot be implemented at the moment because there's no statutory instrument to then support that announcement. And so people have been asking, where is it? How can we implement it? Yet it was announced in a speech, but there was no follow-up statutory instrument to then operationalize those things. So, you know, there are things like that. So while there are many, and there's probably going to be more for us to adequately, you know, respond to the COVID. Now, when it comes to, you know, there was, what we were saying is that when companies reopened, there was no clear guidance from anyone to say, what do we do? These are the steps. Because the people in the private, public sector, they were already bogged down with public health issues in the public sector. And the private sector had to find its own fit. He had to, you know, the doctors or the association had to come together and say, what should we do? What is the best practice? What are we seeing, you know, being practiced elsewhere? What can we do within our environment? So it was really a blind, you know, approach that we did, but obviously a rational approach until we then said, look, these are the steps that we will take. It took a bit of time or a bit of, you know, to have a clear pathway because there was no lead. So each company was doing what they thought would work in their own setup. So the mining sector will have their own way. The manufacturing sector will have their own way. The transport sector will have their own way, because all these sectors have got different needs and they've got different cadres that and they've got different routines in terms of some people staying on the company premises, some people not staying, some people having shifts, some people having you know, working 8 to 4. So there was a whole lot of differences, and each industry, they actually had to come out with their own norms and say, look, this is our norm. And that sort of, we have seen that sort of like then spreading. But at the beginning of the opening up of industry, there was a lot of confusion. Nobody knew exactly what needed to be done. But obviously now things are much clearer. Obviously there are pockets where others are not sure. So the thing is that we don't have a written protocol. But what has happened is that each industry sort of like come up with its own acceptable standards, which are not nationalized or standards, especially for business. So obviously that then had a negative impact on what needed to be done. Where do you take what Nobile was saying? Which isolation center do you use? The list of isolation centers that you can use, the pricing of the isolation centers that you can use, and the capacity of different industries being able to pay for different isolation centers. So obviously that came with that information was not tabulated, that information was sketchy, and even up to now, you really have to hunt in order to get that information, especially when you are a public institution or a business, and that makes it difficult because you don't have information to make decisions on your fingertips.
Well, what are you suggesting as an organization on that particular issue going forward? I mean, issues have not been clear, but what do we do to clarify issues going forward? Lance, would you want to jump in there?
I'm guided here by my medical doctor friend, trustee here on some of the suggestions. But I echo the view of the other trustees. There is a great deal of clarity that is required on a number of things, particularly directionality on business, on policy, on statutory instruments, and just really on clarifying some of the way forward. But Trevor, we must hasten to say that this is called a novel crisis for a reason. Novel to you, it's novel to me. It's also novel to the government. And I think you can see both in South Africa, in Zimbabwe, in the UK, in the US. So we're not necessarily an outlier in as far as this is concerned. I think all of us are bringing in all sorts of SIs as we come in. We're throwing in all sorts of directions. Some SIs don't necessarily fit. Police are chasing away people one day, they want a letter the other day, and stuff like that. So you can see the confusion, the crisis that has really arisen as a result of this, because we are all trying to deal with something that we didn't know how to deal with yesterday. So I'm not trying to give people, a leeway for confusion. But what I'm saying is that there is a great deal that we can learn in hindsight. There's a great deal that we can learn really in leadership, in exercising a clear path of how we are going to direct the business, how we're going to direct the civil society, people, healthcare professionals, in really dealing with this thing here empathetically. And of course, we're going to do the best that we can as BFC, a collection of businesses, just in providing our thoughts, our ideas, just a collection of some of the feedback that we are receiving the various business sectors, so that can be taken into consideration in as far as the policy formulation is concerned.
Fantastic, thank you so much. In closing, Mobile, your closing remarks. I'm going to go around all of you for your closing remark and for your last speech, as it were. Let me start with you, Mobile. Perhaps prior to doing that, your list of beneficiaries, who is benefited from the trust being in existence, for instance. And I heard you talking about assisting a home for people that have suffered domestic abuse. Are you seeing an upsurge in domestic abuse in this environment?
From our beneficiaries, we, as Business Fighting COVID, the donations that came through, especially the food donations, we distributed to the Ministry of Social Welfare, and those went to various centers, and centers looking after that took in people who live, vulnerable people who live on the streets, who had nowhere to go. So they were taken in, and those centers, we managed to send some donations. We also donated to a representative of old people's homes, and she was able to donate to quite a number of them. And vulnerable people also in other communities. We donated also to Musasa. So Musasa does deal with victims of domestic violence. And when the lockdown started, there were quite a lot of messages coming from, whether it was Musasa Project, Zimbabwe Lawyers for Human Rights, Zimbabwe Women Lawyers Association, realizing that when you are in the home with a partner or a parent or in a relationship dynamic for the whole day, continuously for 3 weeks, continuously for 5 weeks, there are some issues that come up, and the increase in domestic violence certainly was reported through those different organizations. So the lockdown then brought to the fore, those issues where people are staying together and looking at each other the whole day. Unlike where someone leaves and goes to the office for 8 hours, then comes back home. But I think that the increase was because of that, and also exacerbated by maybe in certain situations, the economic impact. So financial issues would be surfacing, and just day-to-day survival issues of there's no food in the house, or we're not able to make ends meet, and that has an impact especially on our families. So there was a surge in domestic violence. There was also a surge in mental health challenges, depression, anxiety, and just not being able to cope, and just being unsure of what would happen. And if you remember, right, as the lockdown started, there were quite some very disturbing news coming in from all angles. So that contributed quite significantly to challenges with mental health. And, hearing stories of how many people were passing away a day in Italy, in the UK, in the US, that's very frightening, So it contributed to that. And for me, so my closing remarks would be just, business is trying hard to cope. Of course, there's all these challenges, and certainly the government has tried its best to assist to alleviate the challenges. And as Dr. Chirisa said, that it's not over. The steam somehow seems to have gone, but there is still more room for government to come in terms of the tax holidays, in terms of other areas of alleviation, the distribution of the $18 billion package that was announced by the Minister of Finance, and that sort of thing. So also just business readiness. We are here as the trust to try and continuously assist business in terms of responding to how COVID has affected, operations and so on. Yeah.
A couple of questions to you again, Nqobile. First of all, if you could give out your website.
Thank you, Trevor. So the website is bfctrust.org. And then we also have a Facebook page, Business Fighting COVID Trust.
And lastly for you, Nqobile, sitting there in the Secretariat, you are in the engine room, as it were. What is it that would, what are the pressure points, and what's the greatest relief that you would want to see coming from the business community?
Thank you, Trevor. So the greatest pressure points just relate to that uniform response, because I think from the business leaders' point of view, you don't want to first go ahead of everyone, but you also don't want to not do enough, because the reality is that COVID is not an easy ailment to deal with, especially where someone has underlying health issues. So the pressure points would be to say, we really need those protocols in place. We really need business to be guided a bit more on what to do and how to respond. And then also to remember that it is a humanitarian issue. There is a person that we're dealing with who has a family, who has children. And, how do you then have that communication back and forth where someone then tests positive, COVID positive, and how they can access their family, and just that humanitarian touch from the employer side.
Dr. Chirisa, let me come to you. We've spoken about the need for PPEs. We've spoken about isolation points. We've spoken about contact tracing. And indeed, we've also spoken about, testing, as it were. Where you sit right now as a medical doctor, I know you're passionate about mental illness, as it were. What are the issues that are hugely important for you, apart from what we've just highlighted?
The COVID thing really is a medical emergency. Yeah, it came as a medical, through the medical channel. and the medical teams were really at the center of the whole response. It then obviously spread across to the finances and companies and transport, and affected every part. But it really, its entry point was the medical, and how it's going to be dealt with. It also there has to be a medical component. Mm-hmm. And Mobile has already talked about the mental health issues, which come along with that, with the fear, the anxiety, the depression, the loneliness, whatever the case might be, the fear of losing your job, or even losing your job, and the repercussions in your psychosocial health. So it's really big. And some of the scars of COVID, whether you suffered from it, you're actually going to have scars from it, economic scars, psychological scars, So we have all suffered really from COVID. And so what we are saying, let's do our part with what we can at the moment. We all have got disadvantages in one area or the another. But if we dig deep into ourselves, we can still push towards that dream. And even during this crisis, during this time, there's something that all of us can still do to make things better in this COVID response. Thank you.
I like your dream. I think it's a dream of a lot of people, to have functional medical facilities that are manned by motivated staff. I think it's everybody's dream. Lance, your closing pitch, as it were, in the first instance, do we have an idea of how much has actually been raised before you make your final pitch?
Trevor, we've raised a significant amount of money. We don't usually like to throw in a number, because that will either throw or the other. But I think for us, the need is there. It's greater. It's amongst us. We are all aware of what is required. I've given a needs list. The website that Maverick gave you also has our needs list. So yours and all the listeners can go onto the website and see as well some of the requirements that are there in the various areas that we are currently supporting, and the others that I've mentioned. But as far as my closing remarks, Trevor, I just wanted to firstly say, as Business Fighting COVID, we would like to thank your listeners, your viewers, of course. I would like to thank our partners, people who have really entrusted us with some of their donations so that they can go on to the areas where it's most needed. Some of them have already been mentioned: Citco, Old Mutual, Nedbank, and various others that I have not mentioned. But we've partnered with a lot, and we continue to partner with a lot of people. We're calling on all Zimbabweans really just to come in and partner with us. And our call to each and everyone who is listening is, and everybody who is watching, is that before the World Health Organization, before the IMF, and before the people externally are coming to assist us as Zimbabweans, this is our opportunity to come together as a business sector, as Zimbabweans, no matter where we are, whether at home, abroad. No help is small. We are really calling on everybody just to come join hands with us to make sure that we are putting our hands collectively and fighting this pandemic. That is our core as Business Fighting COVID. We are here to give of our service and of our time, and we can really put in a commitment that when we do so collectively, we believe that we will go far and achieve more as Zimbabweans. And there's no better place to land than, of course, going back to church and quoting that John Wesley phrase that we do all good that we can, by all the means that we can, in all the ways that we can, and to all the people that we can. That is what we are here to do as a Business Fighting COVID, really to ensure that we are putting our hands together as a business sector and directing resources where we believe that they are needed. Thank you very much for having us, and thank you for giving us this platform really to achieve some of the things that we believe we can achieve collectively as Zimbabweans.
Let me thank you, starting first of all with Mobile Mzara. Thank you so much for what you're doing, Mobile, for the nation. Thank you, Lance, for the noble work that you're doing. And Dr. Chirisa, I'm sure the nation appreciates the work that you guys are doing. If you don't mind, my colleagues, stay where you are right now. Let me address our viewers who are in Zimbabwe, on the continent. and all across in the diaspora who watch In Conversation every week. To remind you again that In Conversation with Trevor is a weekly show, and we invite you to click onto this subscribe button so that you get an alert every time we have a new show, and you get an alert and a reminder. So thank you so much for watching In Conversation with Trevor and for your support. We appreciate it. And we pray that you'll be able to support business as business reacts to the COVID-19 pandemic. So until next time, cheers.